If a patient comes to the MAC without a care partner, that presents a unique challenge. We know that not every patient is going to have a spouse or a child who is able to accompany them. So you're going to want to ask the patient if there is a family member that is maybe a distant family member, a friend, a neighbor, a church member, somebody in the community who may be aware of what's going on with this patient. So for the first visit to the MAC, they may provide a big disruption to the workflow if they come without a care partner, but there's some things that are important for you to remember as the CSE. So if they don't have a care partner, you don't need to do the BRI caregiver strain instrument or assessment, but you'll want to figure out as a team how the information about functional abilities is going to be collected. So is that going to be a CSE meeting with the patient, or is that something the provider is going to collect in their visit and assessment with the patient after the neuropsych testing? In between visits, you'll want to attempt to contact any individuals that the patient may have mentioned. You want to make sure that these individuals understand the primary care provider's concerns about the patient, and you'll want to make sure that the individuals understand the purpose of the MAC assessments and why this person is undergoing cognitive testing. You'll want to get as much information from these individuals about the patient's current state as possible. So whatever information they can provide you about how they're functioning outside of the MAC visit will be very important. It's not uncommon for friends and family members to not want to become involved in the person's care. That's a lot of responsibility that they may feel like they're taking on. But it's important for the CSE to try to stress the importance of their involvement moving forward with this individual. At the second visit, if you still haven't been able to identify a care partner for the patient, you'll want to again ask the patient if they have any friends or family members that we can contact. If they still can't identify anyone, that's okay, but it's important that we let our community partners, their primary care provider, the Area Agency on Aging, and the Alzheimer's Association know this information so that they can provide the best support possible for this patient.